According to the American Veterinary Medical Association, almost half of dogs over the age of 10 will develop cancer. And this number is rising every year. As a dog mom, this is a scary thought. On today's episode, I got to chat with a very special human who spends every waking moment possible helping people and their pets with cancer diagnosis and encouraging diet and lifestyle changes for prevention. More than once in today's episode, he brought up factors to health that are so often overlooked, even by medical professionals. You are going to be so encouraged by the end of today's episode, whether you have a dog living with cancer or you just want to be the best dog parent you can be. If you don't know by now who I had the pleasure of speaking with, he is none other than Peter Ciancarelli, founder of the famous Facebook group Allie's Crew, named after his dog Allie, who he lovingly cared for during her long battle with cancer. His story is inspiring, and what he is doing to help people whose dogs are diagnosed with cancer is incredible. You don't want to miss a single second. Have you tried training methods that just didn't work? Do you feel that your pet is not getting his or her nutritional needs met? Are illnesses and bad behavior your daily norm? You're going to want to join me on the Pet Parenting Reset, where you'll hear interesting and informative interviews and get solutions to all your pet problems. I'm your host, Jessica L. Fisher.
I just think it's so amazing what you're doing with the podcast, and the more pet parents we can reach, to give this information and just to show that there are options and just to share info. You never know who you're gonna reach and who's listening. And so I think it's wonderful that we all need to be taking a stand and speaking out, and for the pets.
Yeah, for sure. You never know. Like you said, you never know who is going to hear a message that you put out, and you never know who's going to see a post that you put up. And I actually posted something a few weeks back that was kind of about that, because I started out my journey doing TNR with cats. And so this was like 11, 12 years ago. I met this family who had a bunch of barn cats, and I got them all spayed and neutered. And I don't know, 11 years later, the little girl has a kid and got married. And on her honeymoon, she got a tattoo of cat ears with an ear tip. And I'm like, you just never know how you affect people, right? And you may never know. Like, I was lucky enough to see this post 11 years later, but you just don't know, like, how you're really affecting people. Right. It's like, it's very emotional.
No, for sure it is. I mean, with my Facebook group, which we'll get into as well during the podcast.
Yeah.
You help somebody, you speak to somebody really briefly, but then if you hear from them like 11 months later or a year later, and you don't realize like, oh, the dog or the cat is doing so well, and it just really touches your heart. And you're like, whoa, I forget about things. Time goes on, and it's just really not, you don't know who you're touching and who you're making a difference for.
So, Peter, thank you so much for being here and for speaking to my audience today, because I think you have possibly, the idea behind your Facebook group and the information and education and the help that you're giving to pet parents is possibly one of the most crucial ones that we have today, just because so many dogs, even more than cats, but I love my dogs and my cats, but so many dogs are getting some form of cancer in their lifetime. So tell me a little bit about Allie's Crew. I think you recently changed it. It used to be Allie's Canine Cancer Crew, right? And now it's Allie's Crew, which I know is in honor of Allie. So tell me a little bit about that.
Yeah. So Allie, it's crazy actually, because, yesterday was exactly 1 year since I had to let her go. And so it's a very, difficult, challenging day. I went for a nice long hike with my dog Tucker, who is right here.
Oh.
So I got Tucker a month after Allie passed, and he's really been helpful. He's helped me heal. And so yeah, spent yesterday in remembrance of Allie. Went on a favorite hike on our trail. But so Allie, my stepdad was actually the one that adopted her in 2009, and I think I was like a few years out of high school. Yeah, like 3 years out of high school. I was in college, and was living at home and commuting and all that. And I had built a really nice connection with Allie, and he had a lot of behavioral issues, and was not the dog that my stepdad was thinking that she was going to get. Like, he was thinking he was going to get a dog that he could take to work. She was very reactive, destructive in the house, and just severe separation anxiety, just a ton. You couldn't walk her, like all these things that he wasn't expecting, and he would never give her up, but he was just very frustrated. And I was at the point, I was like, well, I'll take her. I mean, it kind of just transitioned. Like, she started going to my room with me at the end of the night, like to bed, sleep in my bed. And she just became like my dog. And it was, like, I trained her and all that. And she was chronically sick though, like most of her life, like she had a lot of problems with eating, a lot of GI issues, and, got given a lot of antibiotics. Like, we did everything, like, quote unquote wrong, like the conventional, like just all ton of vaccines, antibiotics, chemicals, processed foods, everything that you and I and everyone in the holistic pet community, try to educate people on. So that was my start when I found a cancerous tumor on her, a mast cell tumor, stage 1. I got very lucky. I noticed it right away. The vet surgically removed it. And that's when I started asking these questions, like, well, what about this and what about that? And I'm reading that this is not good. And, and they would just kind of like, don't go down the rabbit hole of trying to do better for your dog, and don't, this is safe and this is fine. And don't listen to Dr. Google. And there's definitely, like, you can definitely find bad information online, you know what I mean? But a lot of people were saying things that were just, everything just wasn't adding up. And so I eventually was like, you know what, I'm going to go to a holistic vet. I'm going to make these changes. And little by little, I made these changes and her health turned around. It was slow. We found a holistic vet. She helped me with I'll talk about a few therapies that we did with Dr. Margot Roman, my vet. And Allie's crew was born in 2018, Allie's Canine Cancer Crew, out of just becoming just so passionate about having to, healing Allie, that I wanted to take the information that I learned and share it with others. And, I just wanted my own little, like, hub of, like, taking videos and documenting stuff, and people started joining, and I started helping people and answering questions. And it just kind of grew into this thing that is now it's over 7,000 members. And, it just, I changed the name because I noticed that other groups with the name cancer in the group were being shut down a few years ago. So I wanted to make sure that, like, my group was kind of protected, and I made it private. So things like that, so that, I wish I could share things outside the group, but I really didn't want anything to happen to the group, so, but it's been a great support for cancer and being proactive too, and just overall health.
Yeah, for sure. And, it is interesting because we do have to be kind of careful about the things we say on social media, and kind of pull people away from social media to really be able to talk to them the way we need to. But yeah, and I think it's important that we all kind of and I sometimes forget this, but I try to remind people as often as I think about it, that I was there too, because just like what you said, that was me too. I was that person that I was constantly at my veterinarian's office with the number of cats I had. Like, I lived there, and I did everything my vet said to do, like, exactly. And there were different times, different points between my dogs and my cats where I was like, there's something not right about this. And one of the things for me with my cats specifically was my vet giving one of my cats were indoors, and they hadn't had any flea or tick medication in years. And one of my cats had this really nasty ear infection that just would not go away. And he was like, well, we need to give him Revolution as part of the treatment plan. Right. And at the time, I literally did everything my vet told me to do. Like, I bought I was buying like 4 different foods for all of my, like, it was crazy what I was doing. And he got a chemical burn from the Revolution. And I told my vet, and he kind of blew it off and was like, well, he needs one more dose. And I was like, well, he's not getting one more dose. He got a chemical burn, right? Like, and it kind of like triggered in my mind that I'm like, this isn't right. And so there are always these little things that happen that kind of trigger us. And we have to be aware that I've been there, you've been there. We're not like talking down to anybody by any means, but like, if I can get you there faster, oh my gosh, like that means the world to me.
Yeah, you said it. I mean, I do phone calls with people almost just about every night. People that reach out to me for dogs with cancer, looking for just friendly suggestions, and just being able to say to somebody, hey, like I've done the research, for lack of a better word, but like I really like medicinal mushrooms, and these are the brands that are the most popular in the pet space, and this is the one that I use, or this is the one that I would look into. Not giving advice, but just something to look into. That you save them a lot of time. And when you're dealing with a diagnosis, you feel like you've been hit by a truck, and you're panicking, and maybe you don't have a lot of time to look into stuff. Can be really, really, really helpful.
Yeah, and when you are hit with a diagnosis, I think we'll talk about that in just a little bit, because that is something very special. Like, that's a very special topic that I think I don't want to like blow past. I want to kind of save it for the end, because it is like you feel in that moment like your head is spinning, and it's really important to stop the spinning. But as I was saying, we're looking at more dogs than ever being diagnosed with some form of cancer in their lifetime. It's like over 50% now, isn't it?
It's definitely like 1 in 2 dogs, or more than 1 in 2 dogs.
Yeah, it's completely crazy. And a lot of that has to do with the same reasons why us humans, especially in the US and in a lot of first world countries, are chronically ill. It's all the same stuff, poor diet, the toxins in the environment, and, toxic cleaning products, what we're spraying on our yards, all of the things that can be very overwhelming. So if you could just, like, from everybody you've talked to, from all the research you've done, what are maybe the top 3 things you look at when you're trying to give advice to people? What do you think is causing this epidemic of huge spikes in cancer rates, and what are the maybe top 3 tips that you give people who are dealing with this, or who want to prevent it?
Okay, well, so I try to, when I talk to somebody on the phone, I try to listen to their what's going on at first and foremost, and see what kind of situation they're in, and what they have available to them, like resource wise. And because for example, really quickly, like I'm so passionate about the gut and microbiome, and taking care of that for our dogs and ourselves. And for example, like there's something called a fecal transplant, and while it's difficult to get that for a person, because there's it can be very expensive. You have to go through multiple rounds. It's complicated to get it as a human. But on the veterinary side, my veterinarian, Dr. Margaret Roman, has pioneered the fecal transplant for dogs and cats. And so I have that available to me. I can go to the vet, pick up a bag of fresh, 6th generation puppy poop, and give my dogs a little chunk, or hide it in a pill pocket, or do something, you know what I mean? And that is going to feed their gut microbiome. It's better than a probiotic, because it's literally, there's so much more in the gut than just a couple 14 strains. And diversity and rotation, and using fresh whole foods is really important too. But sometimes when you've had antibiotics, or you've multiple rounds, and even generationally, the mom had antibiotics, or maybe the puppies were born via C-section, and they don't have the natural vaginal microbiome that they got from being birthed. They can be at a disadvantage, and then they get spayed and neutered early, like Allie was at 8 weeks old or 9 weeks old, and they're missing those critical sex hormones for development and growth, and they can just have so many behavioral issues and health issues. And so I think that the gut is such a huge component, and just like it's one of the main things I'm trying to keep up with my dogs is, my dog and my parents' dog is once in a while I go to the vet, get a bag of microbiome, and I give them a little bit. I split the bag between them, and then that's it for like maybe a couple weeks or a month. And I really try to invest a lot in that. But not everyone has it available. There's freeze dried. I mean, they really do, but there's freeze dried options. There's, you go to a vet clinic for like a fresh slurry, rectal slurry. That's the best. So that's a whole big conversation I'd love to get into, but I really take into account the person's situation, where they're located, their resources, and do they even have a holistic vet? Maybe I'm going to help them find one that's in their area, or maybe they don't have one in their area, like even within a comfortable driving distance, which has happened quite a bit, I found. And then I help them say, hey, are you interested in like consulting with somebody virtually, a pet professional? And I work with herbalists and homeopaths, and I know lots of integrative or holistic veterinarians that are doing online consults, and I can direct them to somebody that can give them guidance. Not that Facebook groups aren't wonderful, but I really sometimes feel like if possible, you need somebody there to look at the whole picture, and help you with that, and someone that's going to be able to support you and is on the same page as you. So I like to start there. And I like to, of course, like a lot of people come to me for medical cannabis oil. So I work for a company called King Harvest Wellness, and I do free no obligation consults with King Harvest, and we send them medical cannabis with CBD and THC, and we give them dosing guidance, and I help them along with that. And that's a major thing that I do in my group that people come to me for. So most times people reach out to me, they're interested in that, but we ended up talking about other things as well, like them gut, different supplements. Maybe I'm helping them with diets, getting them off of kibble. Like I talked to somebody the other night who was feeding, on his kitchen, and it was very carb heavy. So the dog had a lot of like arthritis and stuff. And I was like, let's get them onto a more like anti-inflammatory diet possibly. So I gave them a few options, commercial options, recipes, things like that, just giving them information, not saying do this, but just giving them options, I think is really important so they can choose for themselves. So that's kind of what I do. And I don't go too much into like why I believe cancer is happening, although I do have my reasons, but not everybody agrees with it. Like I feel that, over vaccinating our dogs is a major reason of that. But I talk to people that, that are working in conventional medicine or work for big pharma, and that can be kind of, tricky sometimes. And so if they're looking for that information or they want to ask my opinion, then I offer it. But I try to go from a more of like a support stance and say, well, if it was my dog, I wouldn't get that rabies shot that's coming up because your dog has cancer. And I don't think that challenging the immune system or is really a good idea right now, in my opinion. And here are some resources that you can check out that might support that. It can be really tricky. You know what I mean? So I take each call, basically the answer to that question, I take each call individually and kind of feel out who I'm talking to and what their resources are, what their budget is, and everything like that. Cause I think it does make a difference, cause I don't want to overwhelm anybody either and make them then they're not going to do anything. You know what I mean? I want to be helpful. So, yeah.
Yeah, you said so many things that I'm like, oh my gosh, I'm so glad you said that. And I want to start with the fecal transplants and the microbiome in the gut. I had Dr. Odette Suter on the podcast not too long ago, and she is a big proponent of, the fecal transplants. And she said something to me that really, really stuck with me. And she said that she doesn't even recommend pre and probiotics anymore. The only thing she recommends is fecal transplants. And I feverishly called every veterinarian I could find on Google in my area, and nobody is doing it. So I was then left with, animal biome is there if you don't have somebody locally who can help you out with this, which I think is great. So that is very important. I think so many of us think, okay, our brain controls our bodies, right? And with all mammals, because I think a lot of times we forget that dogs, cats, humans, we're all mammals. We're a different species, obviously, but we're all mammals. So we function very similarly. And a lot of people think the brain controls the body, but the gut controls the brain. So
80%,
and
80% of the immune system, so it's a big deal.
It is a big deal. Today's episode is brought to you by the Furry Family Coach Dog Training. Train your dog in the comfort of your own home and on your schedule with video instruction from me. Learn the foundations of training, teach basic cues to your dog, and explore solutions to behavioral issues, all inside of this video-based online training course. Go to thefurryfamilycoach.com and use code podcast at checkout to get your first month for only $7. That's thefurryfamilycoach.com and use code podcast at checkout to get your first month for only $7. I can't wait to see you on the inside. I did want to ask you about Allie, if you don't mind me asking. Once you got her a little bit healthier, when you were ceasing vaccinations, getting her on a healthier food, did you happen to notice any behavioral changes?
Yeah, I did. I think it's so complicated though, Jessica, because when I went to go see Dr. Roman for the first time with Allie back in I think it was 2016 or 17, maybe around 2017-ish. I walked into her office for the holistic, consult, and I didn't know her. She's one of my good friends now. I didn't know her like that. It was my first time meeting her, talking with her. And they have you watch all these videos on their stance on vaccines and diet and homeopathy and things like that. So you walk in and you're on the same page, right? Because they want the right clients as well that are going to take their suggestions. But when I walked in there, I was just like, I want the fecal transplant. I want this. And she told me something about, I think Allie is classic, Plechner syndrome. Plechner syndrome is an endocrine immune imbalance. And I was just like, no, I don't want to do the test. I don't want to do that. I just want the fecal transplant. And, she got worse. She eventually was declining more and more and more. And then I don't know how long it took me to realize, okay, something is she's not getting better. And now she's even worse. She was emaciated, skin and bones. She was dribbling urine, just had really declined. And that's when she was like, okay, we need to do this test. And it's because of a lot of dogs. It's called, Dr. Al Plechner talks about the medical ice age, which is, the planet's so toxic, the meat is toxic. The air you breathe is toxic, everything. We're destroying our planet, and our dogs are the canaries in the coal mine. And they're being if they could talk, they'd be like, wake up, And so we gotta, we should be doing the same things for ourselves that we are for our dogs too. And I wasn't at the time. And I also got sick several years later, and pretty bad. And so, I think sometimes I feel like it takes tragedy to recognize that you need to make some changes. And, but basically the fecal transplant, she did that fecal transplant and it was helpful, but because of her being spayed and neutered, spayed so young, there was that missing component where it's her cortisol, the stress hormone, is defective, and her adrenals are working overtime, and it's causing elevated amounts of toxic adrenal estrogen, and her thyroid's off, and her immunoglobulins, her IgG, IgA, IgM are low and critically low too, and it's hormone havoc. And even giving gut support at that point when you're missing that critical piece is it's not going to make much of a difference. So that's where I think I saw that, one of the reasons why she got cancer was this hormone issue. And I think is a big reason why a lot of dogs do. But I think that, this whole spay neuter topic and stuff like that is not a topic of conversation where it needs to be right now, mainstream, but it's great that it's being talked about. And obviously overpopulation is a major issue. So we need to talk about all these things, and how we can come to a resolution where we're not setting our animals up for failure, their immune systems up for failure, but also addressing the big problem, the elephant in the room too. But yeah, I forget the original question. So,
That's okay. It's okay. You pretty much answered it with, it wasn't so cut and dry with behavior. I selfishly ask that question all the time to people because so I I am still technically a dog trainer. I do still get paid to go into people's homes and train their dogs, but I don't do it as much anymore. I've just become more passionate about health. And when I do go in and people do take my recommendations of upgrading the diet and cutting out a lot of the inflammatory foods, their pets, their dogs' behavior radically changes. It's just something that I see all the time. And I'm really, really glad you brought up over vaccination because I watch as much as I can when veterinarians are on social media and they're talking about different topics. And one of the things that more often than not, when I'm done watching a video, I feel like gets overlooked is the over vaccination. I think there's a time and a place once puppies are old enough and you can give them what they need. I think the vaccine schedule is not great. It needs to be altered, spread things out a little bit more, but then we can do the titer testing, which I know, my listeners have heard me talk about many, many times. I'm just so glad you brought it up because I do think that it is very often overlooked.
I think that a lot of pet parents they don't want that for their animal, but they're oftentimes backed into a corner and there's a lot of fear involved. Like for example, my parents' beagle Shadow has a lot of chronic skin and allergy issues, and we just found out a few months ago he has Plechner syndrome like Allie does, and so we're addressing that. But it was he had a really rough summer. He spent 2 months in a cone, and because he was just tearing himself raw. And we're throwing all these things at him, and it's ozone, micro fecal transplant, supplements, diet, food, everything, homeopathy. Nothing is making a difference at this point. Like it was helping him before, it got him but now he's crashed again. And so Dr. Roman was like, we got to look at Plechner. And he had a rabies vaccine coming up too, like in May. So I was trying to figure all this out, and my parents were scared of like if they don't vaccinate him for rabies, they can't license him, and then they get caught or he bites somebody, which he's not going to. He's mainly an indoor dog. Like he should be exercised more. I don't live at home anyway, but it would have set him back so badly if he got that rabies vaccine, and it was a huge issue. Absolutely. So it was expensive to try to figure all this out, run the Plechner test. But now that they have the confirmed diagnosis of this endocrine immune imbalance, now he can get a rabies vaccine in November next month, and he's going to be, okay. But unfortunately, a lot of veterinarians have, a knife to their throat by the board because they can't write a rabies exemption for allergies. Right? That should be the case, but it's like almost like the dog has to, I've heard this from vets, like they have to have cancer to get a vaccine waiver, so I feel like a lot of, pet parents are backed into a corner, and a lot of, integrative and holistic veterinarians, even conventional ones that are open-minded and learning, and they mean well, but they're also got their hands tied. So I think that just things need to change, and just there needs to be more education. But with Allie, I lied. I went to the town hall and I was like, she died, or I rehomed her to my brother in Florida who doesn't live in Florida. Anything I did what I had to do to get her out of the system and to be not a number, and so that because I don't, and I just had good control. I'm also a dog trainer, and I would hike with her every day in the woods to do trail walks, and so I would make sure that I had her behavior under control to make sure that she's advocated for and she's kept safe, so that there's less likelihood of an incident, or where I'm going to have to be, quarantining her or getting her a rabies booster. That was the stressful part. But, I think, I think it's scary. Like I remember the first time I stopped heartworm medications with her, the prevention, that I was scared to death because it's like, oh my God, if you don't do this, then your dog's going to get heartworm. And it's just like spay and neuter. There's a lot of fear and a lot of like, it's tough. It's tough out there. You're just trying to do the best you can for your dog. And, it's tough to navigate it all.
Yeah, it is. And it was interesting a few weeks ago. My
Same
timeline
with
is
me.
off. I have no concept of time anymore. But Dr. Judy Morgan had posted a link to a study where they found connection in dogs between the uterus and brain development. So taking out that uterus at 8 weeks of age, right? Or even 13 weeks of age, even 6 months of age, right? We're talking about a drastic
Yeah.
trauma to the body. Not just, oh, my dog
Right.
can't get pregnant. Okay. What
Yeah.
trauma have we caused to this dog, right? Internally, because the hormone development is so critical. And just on my own personal journey, I use this a lot in comparison because, again, we're both mammals. I have been trying to get my hormones straight. And I've tried so many things and so many things and so many things. And the only thing, I just went to my holistic health practitioner yesterday and she muscle tested me and was like, you're finally good. And what changed is that I found a company doing desiccated organs in tablet form, and I'm taking ovaries and uterus and fallopian tube, and that's what I'm feeding my body. And I think the same thing is true for our dogs, right? If we're deficient in something, then we need to feed in something. I think that's a very Chinese medicine kind of, So I think getting our dog's hormones in balance, like you said, is so, I mean, how many veterinarians even talk about that, right? Like it's just way over.
And that's
there.
exactly what I told Allie when I learned about it. She was dealing with this and had Pleckner, and but there's also Cushing's and there's Addison's and there's other hormone imbalances. So I put her on a supplement that it had, the ovaries, the uterus, the thyroid, things like that. And for Tucker and Shadow, there's one for males too. And it's there's human products, there's pet products, and so I think that's benefit. When I adopted my dog Tucker, I've had him for almost a year. Like on Thanksgiving, it'll be 1 year. I've had him. It was one of the first things I did with him. I reached out to my homeopath who I work with, Andrea Ring, and we detoxed him. We did a homeopathic, anti-rabies remedy because he had just got a rabies shot. We did the Adored Beast anti-vaccinosis product, which is helping detox from the other vaccines, but not get rid of the beneficial, stuff from them. And also, put him on the hormone support. We did some gut support, and that's kind of the areas that we targeted like right away. And, at 11 months when I got him. So I don't know when he was neutered exactly, but I know he wasn't, his mom was killed by a rancher. Like his litter was found in a haystack, and I bet you he wasn't getting like the mom's milk and things like that. So I put him on colostrum when I got him home, things like that for his immune system. So but I wouldn't have known all that if it wasn't for what I learned from Allie. And so I could give him a better start, with what I know. But yeah, I mean, I'm glad you're figuring that out for yourself because it's very similar. We have to have the same mindset for our dogs, and
Yeah, absolutely. I got very lucky when I adopted my dog Kim. I was always a cat person for many, many years. I didn't adopt my first dog until like on my own. My family, we had dogs growing up, but they were hunting dogs. I lived in Virginia. My stepdad was a hunter. Dogs lived outside, that kind of thing. So it wasn't until I met my husband, which was 12 years ago. Immediately, when I moved in with him, I said, I'm adopting a dog. Because he had a dog. I said, well, I want my own dog. And she was a hot mess, like a hot mess. She was confiscated from a hoarder and taken to the local shelter and put in a foster home with 40 other dogs. Like literally, you could barely walk in this house. There were dogs everywhere and getting no medical care. I adopted her and she had all of her teeth were rotting out of her mouth. She had a mammary gland tumor because she had just had puppies and all the puppies died. Yeah, it was terrible,
Yeah.
but I got her all, better, and she did really well. She had seizures, and I eventually, that for my dogs, that's how I realized that fresh food was like gold, because I started feeding her fresh food and her seizures
Wow.
were
Great.
like non-existent anymore. And so that just like spiraled me down this path. And Kimberly, when I adopted her, she was 2.5, they estimated, and they had just spayed her when they brought her into the rescue. So she got probably 2 good years with her uterus.
Yeah.
So I think I got lucky
Yep.
with her because of that.
That's
and we just don't really have, I mean, of course, she's the most spoiled dog ever, especially according to my husband, but she gets all of the good raw foods and goat's milk every morning and all of the things, but I'm just so blessed to have a healthy pet. I know I'm blessed to have a healthy pet. My cats aren't so lucky because they're all older, and so they've grown with me through this transition. So they were kibble fed for many years, but
cats can be more challenging, to transition to raw or fresh food and all that, and to to give medications to and all that. But that's a whole nother. Yeah, that's amazing. That's amazing.
Yeah. So I want to be aware of your time, and I so appreciate all of your insight, but I do want to ask you, what kind of advice do you give people when they get that dreaded diagnosis at the veterinarian's office? For me, like, getting to somebody prior to diagnosis is so important, because you really want them to be able to take a breath in that moment and say, thank you, I'm going to take that information and research and not do anything like rash, right? Somebody gets a cancer diagnosis with their dog. Like, what is the first thing you want to tell them?
I try to be sensitive to the situation, and I ask them how their dog is doing. I ask them what their name is and details about the dog, and anything they want to tell me about, how they got the story, how they got the dog and things like that. But I want to know, like, how is the dog doing today? How are they feeling? Are they showing any symptoms of the diagnosis? Are they eating? What's their energy level like? Do they have any other medical conditions or issues like arthritis or, GI issues, things like that, before we start talking in just kind of have a baseline knowledge. And so I asked them if they're working with a holistic vet or an integrative vet or a conventional veterinarian. And I asked them if not, do they need help finding one? And, or, virtual consults, things like that. I asked them what they're feeding their dog, and it's all like every person has different, they're doing things a little bit differently, right? So you when you have a lot of knowledge, like you and I, you can give them options, which is great, like various foods and things like that. But what I like to usually they reach out to me for cannabis oil. So we do talk about that, but I like to help them with, diet and supplements. I like to recommend, some things like, turmeric, golden paste, medicinal mushrooms. Like if the dog has arthritis and they're older, then I'll be like, are they on any kind of joint support? And I'll tell them what I'm using and, various options that I think are quality, based on what I'm seeing in my Facebook group. But also, I have a couple of friends that are very knowledgeable and own holistic pet shops. They're in one in Chicago, and and they are very, very knowledgeable, and they tell me what are the best joint supplements that they think that that they know of. And so I kind of gather that information so I can give people options, because there's dogs of all sizes, and not everyone can, there's going to have different price points and things like that, and budget and all that. So I try to help them prioritize, what is going to be the most important things to focus on. And diet to me is always number one. And, then we would look into things like, like cannabis oil and what can we add to the diet? I'm not so sure that, like, if they can change the diet and go to a completely fresh food diet, if they're feeding Purina, let's just say, and adding mushrooms to the diet is great, the kibble, but I'd rather see like first and foremost like some processed food removed and then more fresh food added as much as possible, or completely switch and even give them like these are the lesser of the evil kibbles, you know. If you need to stay on it, you know, adding things like raw goat's milk, bone broth, you know, if a dog's not eating and they're sick or they're old, like bone broth has a lot of nutrition. Raw goat's milk is great. You know, I just try to give as much, you know, help and support as possible, but it truly depends on where they're currently at in their journey. And I try to, I really think prioritizing is the most important thing, instead of just being like, you know, do this, and then completely overwhelm them, and then they don't do anything because they just leave the phone call overwhelmed. You know, that's taken me a while to really kind of fine tune, and over the last like 6-7 years talking to people, you know, and making mistakes and things like that, and you know, making someone feel judged or like they're not a good enough pet parent. I think a lot of us have done that unintentionally, you know, and also just being sensitive because they just got a diagnosis, and, you know, checking in on them, seeing how they're doing, you know, and giving them links to other resources, you know, like for example, like if I'm recommending a diet change, like one of the companies I typically throw out there, one of several is Dr. Harvey's, and you know they do free consults. You can speak with Dr. Harvey, and it's like, why not? Hey, take advantage of that. It's free, you know, and see what they have to say. So I think doing things like that is really important. And so my phone calls and consults are typically like focused on those areas.
Yeah, I agree with trying to navigate overwhelm. And I also think it can be really important to
Yeah.
just do one thing at a time, not just to combat the overwhelm, but also so you can see what is helping your dog. Because like you said, every dog, every situation is
For sure.
individual. And you just don't know, you know, how far along, how progressed the cancer is, underlying conditions, all the things. If you can just change one thing at a time, then you can actually see what is helping your dog and what may not be helping as much. That's I think a very, very important tip for people, because it is overwhelming. Once you dip your toe in, it's like, oh my gosh, I'm drowning.
I know, I agree. And I think another area that I focus on, I think is really important, that I've only been able to like help people with because I had to go through it myself with Allie's end of life care, and her last chapter is, you know, because when Allie got cancer, I spent like the next 5 years after that just like diving in and just throwing the kitchen sink at her and not taking care of myself, you know, really much at all, which is terrible to admit, but it's the truth. And you know, and just like kind of treating her like an experiment in a way, which is not like I wasn't, but I was very treatment focused and supplement focused, and being so strict. Like I wish I had let her enjoy life more, you know, taken her on more trail walks and done more trips and excursions, and you know, given her a little taste of my ice cream cookie sandwich, you know what I mean? Things like that. But because I'm just like, I was focused on not the cancer, not ever returning again, I was just way too strict for my liking now that I can have perspective and look back at that. So when she was diagnosed with kidney failure and intervertebral disc disease, and she was going, you know, losing her mobility, and she couldn't do her trail walks anymore, and could just like go on the trailhead for a few minutes or the field, and you know, having all that stuff like ripped away from me, you know, was like a huge eye opener. And I started changing my perspective on like, you know, support. It's not all about curing, because you can't control really the outcome, and you can't control how much time someone has much left on this earth. So just taking a stance of like, I'm going to support my dog the best that I possibly can, and I'm going to be able to rest my head on the pillow at the end of the night knowing that I'm doing my very best, and be okay with that. I think that's so important because, you know, like I think people just, I mean, I understand like they just get so stressed and overwhelmed. I got to save my dog, and it just completely consumes them. And while that's not a bad thing, you know, I think we're also missing the message that our dogs are trying to teach us. And one of the messages I feel Allie was trying to teach me was that, you know, I was so emotionally dependent on her too. Like, just like separation issues, so bad. Like, I really didn't know if I was going to be okay when she left and when she transitioned. But I feel like having the support of friends and family and talking to so many people like you do, like you talk to guests and pet parents as well, that just talking to somebody was so helpful to be able to, tell them about Allie and to express what I'm going through. And eventually I did realize like I'm going to be okay. And I think that piece of like dealing with cancer and end of life care is really not talked about as much, the emotional aspect of it. And so, yeah, I just like to focus on how we're going to support the dog and the human through this process and do the best we can to get the best, outcome possible.
Yeah, I appreciate that. I know I need help in that area too.
Yeah.
It's end of life is hard. But I know personally I have enough perspective to realize that quality of life
Mm-hmm.
is more important than
Really.
quantity. But it's hard in the moment. It's very hard in the moment to make those decisions, and you're constantly second guessing yourself. But, it is. It's about putting them first instead of
Right.
I want more time
Yeah.
with them. It's,
Yeah.
are they
For
ready?
sure. And,
Are they ready?
it was really
For
strange.
sure.
Like I had a mental checklist of things I wanted to do with Allie before she left this earth, physically. And like, so it was like one more trail walk and, I wanted her to have like a really good, like, last meal and things like that. And, say goodbye to my parents' dog and say goodbye to my parents. And, I just had so many things I wanted to accomplish, do one more trip to the mountains, or just go on a nice drive with her in the car, things like that. Have her see her other dog friends or dog best friends that she, grew up with that we still keep in touch with, and my friends that loved her very much. So I had all these things that I wanted to do with her. And it was weird when we finished the last thing that weekend, like a couple days later is when she like let go. And it was really bizarre. And I knew what was going on. And I had thought about also like how I'm going to deal with this, I would prefer her to go here. But I think it all happened the way it was supposed to. And it was a beautiful time being able to support her in her end of life. I would rather her be with me and than be with somebody else where I feel like she probably would not have had as good of a chance with somebody else, that would have gone to the lengths that I did. I left no stone unturned, just like you did, So yeah, I just think that, it all happens for a reason, and it's just great to be able to go through this with our dogs, this journey. He's
Yeah.
doing good.
So
I'm
how's
giving him a
Tucker
bum
doing?
scratch right now. We're gonna go on a trail walk in a little bit, and he's great. He's a great dog. It's been a long time since I've had a young shepherd mix like Allie. Like she was old. She was 12 and a half, and she was easy, and she was like so well behaved. But this one is a wild card, and he needs a lot of walks and exercise and mental stimulation and good food and all that stuff. He's doing great. He had a month after I adopted him, after going through everything I did with Allie and just being exhausted. Like I knew when I met him that he was supposed to be mine. Like, and I adopted him. But a month after I got him, he tore his ACL. He tore his cruciate ligament partially, and so that was expensive and stressful. And so to have to go through that right after with Allie, but we did it, and he's doing great. He's doing great. He's doing wonderful. Thank
I'm so glad to hear that. I'm so glad. So, Peter, I am going to let you go, but I have one more question.
Oh my gosh.
What is your favorite movie?
I'm terrible with my favorite. Okay. I'm going to have to say Dumb and Dumber.
Okay. Oldie, but sure.
Yeah.
Awesome.
Yeah,
so comedy is your thing.
But that's probably, I mean, I didn't expect to get that question, but one of my favorite movies.
Awesome. Well, yeah, I like to try to end with like a fun little, I don't know, get to know you kind of question.
And the dog doc, the documentary, the dog doc about Dr. Marty Goldstein's clinic. I love that one too. Wouldn't call it a favorite movie, but like I like all sorts of movies, and I like to laugh sometimes, and other times I want to, see something like that.
Awesome. Well, hopefully somebody out there also loves Dumb and Dumber and they just connected with you. And where can people find you, and how do you do your consults?
So,
Tell people how they can.
I'm a little bit scattered. So my
action.
Facebook group is facebook.com/groups/Allie's Canine Cancer Crew. It still has the old name in the URL, Tucker, off. And but you can just go to Facebook and type in Allie's Crew, and it's I know you can spell Allie a bunch of different ways, but it's ALLIES. So Allie's Crew is the Facebook group. You can join. It's a private group. We'll have a lot of admins in there, and you'll be approved. And you can make a post about your situation if you want, or just read up on stuff in there. You can message me privately. I'm not shy about giving out my cell phone number. People can text me if they want. And I do consults over the phone. It's not it's not a paid consult.
Awesome. So Allie's Crew is on Facebook is the best way to really connect with you.
Yeah. And if you see me on Facebook, you can shoot me a private message, or and you can just reach out and say hello too. That's another way. But you can definitely find me in my Facebook group, Allie's Crew.
Awesome. Well, everybody, make sure to go to Facebook and type in Allie's Crew, especially whether you're going through cancer or something else.
Yeah.
I mean, you never know, right? I just like to learn about stuff just in case.
Yeah, no, it's great. It's great to just learn and be connected to like-minded pet parents, and it's a great community. I really pride myself on it. It's one of the reasons why I created the Facebook group was because it's, not non-judgmental. There's no fighting. If you feed kibble, we're not going to ban you or delete your post, or it's not like that. So it's really a good environment, I feel. And we worked hard to create that and make it a safe place for people to come to for help and to learn.
Awesome. Well, Peter, thank you so much. Guys, make sure you go to Allie's Crew. It is a group on Facebook. So when you search for Allie's Crew, look for groups. And Peter, thank you so much. I'm obviously, it's been a year. I know you're still grieving for Allie, but I think we can all agree that we're very grateful that she was in your life because she led you to where you are today. And so happy that Tucker is doing well, and just wish you the best.
Thanks.
Give your pets some extra love.
Yeah, you the best too. Thank you. It was really wonderful to talk with you. Thank you so much. Thanks for
you too. Thank you so much for listening to today's episode. Make sure that you're following the show so you never miss an episode. And please take a moment to rate the show on your podcast app. I'd also love it if you'd share this podcast with your friends and family so that they can benefit from the information to help their pets live long, happy lives too. Don't forget to take advantage of this special discount as a listener today and get access to over 100 online videos and my online dog training, The Furry Family Coach. Just go to thefurryfamilycoach.com and use code PODCAST at checkout to get your first month for only $7. That's thefurryfamilycoach.com and use code PODCAST at checkout to get your first month for only $7. I can't wait to have you join and see you on the inside.